So I've put together a flow chart to help you navigate your way through the course. When it comes to forward head posture, there's a lot to consider and to know, and I don't expect you to get it even the first time you make your way through the course. I've been studying the physics of posture now for over 20 years, and I'm still learning. So I really thought it would be important to create a little flow chart for you. So I'm going to review it now, even though we haven't gone through the course, so that you have an idea of what you can go back to. And I recommend that you print this out and have a pen or marker handy so you can mark little notes as you go along. So forward head posture. Let's start by saying that subjectively, you're going to consider yours either mild, moderate, or severe. And I've given you a little guideline, a little picture here. Either you've got some mild forward head posture. Notice I've put a little mark from her shoulder. Same with each of these individuals. That's a great way for you to begin the course. You can do the same, just take a picture, have someone take a picture with your phone from the side and email it to yourself, print it off and do the same. Draw a little dotted line straight up from your shoulder and check out your forward head posture. Notice with this gentleman here, I've put a dot in his shoulder, but his shoulders are quite round, so the dot probably would sit a little further back, making his forward head posture seem worse. So let's say you consider yours to be mild. It's more of an irritation. You don't like how it looks, but it's not horrendous. So for you, I'm going to say the cause of your forward head posture is likely your habits of daily living. So that's the place you're going to start. We talk a lot about habits in the course. We're going to look at how to set up your car seat correctly, the best sleeping postures, your desk ergonomics at work, where you should put your chair so that your hips are in the right position, and then everything else like washing your dishes, sitting on the toilet, and reading. Do you have an awareness about your habits? So first of all, you start out with an awareness and then you change those habits. Next, you'll need a generic exercise program. I know many of you are already doing some of my courses, for instance, posture size, which addresses the whole body. And still others of you may use yoga or Alexander technique or your own little routine that you've created. Whatever program you use, you need to create a daily habit and one that can be with you for life. And it addresses everything from head and neck to thorax to lumbar spine. Next in the process of correcting your forward head posture would be mirror image exercises. We'll talk again a lot about this and I'll show you some really great exercises. So the mirror image, think about your posture, your forward head posture, with the head coming forward. The mirror image of that would be the opposite. That's why we do the chin tuck. That's one great example of a mirror image exercise. Okay, so what if your forward head posture is moderate? So like this lady here, we're starting to notice our posture quite a bit. Maybe you've been hiding it with some clothing, you've been embarrassed by it, and other people perhaps have even commented, and it's been going on for a long time. I'd consider that moderate. And there are other questions you need to ask in this case. The first question I always ask with someone with moderate head posture, or anyone really with forward head posture, is, do you have a neck hump? This is what I consider a yellow flag. Now, there are many causes of neck hump. That's why I did a whole course just on that. But for the purposes of this course, we're not going to talk about certain drugs that can cause neck hump or hormone-related conditions. We're specifically concerned with neck hump that's due to damaged structures in the neck. Now, you don't need to know about that yet. We will address it in the course. Just know, do you have a fatty neck hump? That would be approximately this region on this lady here. Now, she doesn't, but that's the area you're looking at. If you answered yes, the next question should be, have I had a past trauma? And I'm talking right back to childhood. So those could be things you've forgotten. You may need to ask your parents if they're alive. Have you fallen down a flight of stairs as a child, off a jungle gym, over your handlebars? I've done all of those things, in fact. Was your head hit? Have you been in any violent relationships? Oh, really important questions. Have you been in a car accident over 20 miles an hour, even if you walked away? The answer then is yes. You've had a trauma, even if you've walked away. I'll say that again. And following from that, if you answer yes, the next step must be, or I highly recommend, that it's getting some x-rays for your neck. let's go back to this question. What if you answered no, you don't have a neck hump? Well, still, I recommend that you ask the next question. Have you had a trauma? If you haven't had either of those, let's go right back to the first loop here and follow the same process. What are my habits? What can I improve? You're going to learn about that in the course. What generic exercise program will I choose that addresses all parts of my body? And what are the mirror image exercises I'm learning in this course? Now, what if you come to the trauma question and you can't think of anything? Well, before you say no, I'd ask you one last question. Have you had stitches in your body? That may give you a reminder of a trauma you've had. For instance, I had stitches on my face by my eye because I was hit with a baseball bat when I was about 9 years old. That was significant and was a big part of my future chronic headache condition. Now, other things to think about. Have you had a cast on your body? Were you taken to hospital? Again, maybe ask some family members. If you're pretty sure that no, you haven't had a trauma, we're going to consider the next major cause of forward head posture, which is a compensation. So in other words, your head, your forward head, is compensating for a problem posture lower down in the body, specifically slouch back posture and sway back posture. We do a whole section on each of those in the course. If you answer yes, you have one of those, once again, notice it's the same process that we reviewed over here. What are my habits? What do I need to change? What's the generic exercise program I'm doing? And not only will you be doing mirror image exercises for your forward head, but you're going to learn some pretty cool mirror image exercises for your slouch back or sway back posture, and you'll learn those in the course. Now, finally, if you're one of the ones who has severe forward head posture, and I don't think there's going to be any doubt about that. You can see this young gentleman, so it's not an age-related issue necessarily, definitely has what I consider severe forward head posture. And one of the medical conditions for taking x-rays is severe posture abnormalities. So you don't need any other reason to be qualified to have an x-ray through your doctor. Now, if your doctor gives you a hard time about x-rays, some are very cautious about radiation. I want to tell you this. One long haul flight from Canada to the UK is the same amount of radiation that you'll receive for a lower spinal x-ray. Just one flight. How many have we all had? So I think we need to weigh up the risks and benefits. There's no way I would not take an x-ray for somebody who had a forward head posture situation like this. So you have severe posture. You know what? We're bypassing all the questions. We're just going to get some x-rays taken. If you can't get them through your doctor, I recommend you go to a chiropractor because we often have x-ray facilities on site, or any other private medical practice, particularly if you're in the States. The x-rays you'll need, again, this is going to vary. Most chiropractors will want to examine you first, particularly if you have slouch back or sway back. You might be getting other spinal x-rays, but you'll certainly want the standard medical views for your neck, which is a front and a side view. AP, which stands for anterior, posterior, and lateral. The next important question, you've had your x-rays taken, you're going to get a diagnosis. If you had them taken with your doctor, they're going to really focus on the medical issues. Do you have any degeneration? Are the discs worn? Are there any bone spurs? What's the quality of the bone? Is it thinning or is it good and strong, white, healthy looking bone? Now, if you go to a chiropractor, you will get a medical diagnosis. They will address those things, but we also take into consideration the structure of the spine. This is so important. So do you have a flat or reversed curve? You should have a C-shaped curve inward at the neck, but often with these severe cases, you've got a flat or reversed curve, and they're often due to having had a past trauma. If the answer is yes, this is you, absolutely, I recommend that you have some form of manual treatment. You'll also notice, of course, I recommend the same ongoing practice, changing your habits, generic exercise, use the mirror image exercises, but you'll absolutely benefit hugely from manual treatment. And in fact, I've never known somebody with a flat or reverse neck curve to improve at all without some form of manual treatment from a chiropractor, a physiotherapist, or an osteopath. It's going to help to break up sticky joint adhesions so that the rehab exercises you get better results and longer lasting results. I would tend to use a fairly intense treatment schedule with my clients 2 to 3 times a week for up to 12 weeks. And accompanying the manual treatment is traction. The only way to correct a flat or reversed curve is by using traction, which helps to restore the normal C-shaped. Now, if you're working with me, I'll often prescribe a home foam unit, but many chiropractors with the same biophysics qualifications also use these rolls. A home traction unit may be enough if you just have a flat curve, but if you've got a reversed curve, the only way that curve is going to straighten out is using in-clinic traction with this specialized kind of equipment. This is just one example of what we use. Using weights and pulleys to literally pull some curve back in over time. Now, this looks pretty intense, and it is intense, but we start people off on only about 30 seconds, and you work up generally to about 20 minutes a day. Now, I know that this standard treatment tends to be about 3 times a week of traction, 3 to 4 times for 12 weeks, with the idea of doing another x-ray at the end of that. So you can measure the progress. Is the curve correcting? Is it straightening out? Are you getting that C shape again? And all the while, you'll be using these at home, changing your habits, your generic exercise, and your mirror image exercises. Now, that was a lot to take in. Don't even worry if you think, what? You haven't yet done the course. You've got a lot more to learn. And I recommend come back to this lecture, maybe every 10 lectures or so, come back and review this. You might want to write some notes, particularly down the track that you think you're in, severe or moderate or mild.